time that I'm hoping that I see some droopy eyes in the room, and I'd like to wake you up a little bit with a song that I serenaded my wife with 20 years ago. There's a group called Erasure that's coming to the area in Oakland in a couple weeks, and they're my favorite group. There's a song that epitomizes not only my love for my wife and family, but also my love-hate relationship with electronic health records. And I want to sing you the first minute of this little ditty. I try to discover a little something to make EHR sweeter. Oh baby, refrain from breaking my heart. I'm so in love with you, I'll be forever blue. That you give me no reason why you're making me work so hard. That you give me no, that you give me no, that you give me no, that you give me no soul. I hear you calling, oh baby, please give a little respect to me. So that song resonates with me because I feel that physicians really don't get enough respect for the amount of effort it takes for us to be using our EHRs. How many clicks do you have that you have to get through just to sign in, just to get a chance to see that darned EKG that you need to see for this patient with chest pain? How much work does it take? It just feels like there's just so much heartbreak in using our electronic health records. And I'm hoping that we'll be able to use products, and I'm so excited that we have a couple of vendors today that if I had a chance to use, it would be really fabulous in terms of this decade long that I've had of typing in text templates that I've designed myself. I've worked with teams across Sutter to make these as usable as possible, making order sets that would be able to make it easier for us to do the right things, for picking the right tests and the right medications for each individual diagnosis, and picking the right diagnosis codes so that now we pick the right HCC codes for the patients that we're caring for. I'm just saddened at how much work it's taken for us to get to this point, and it's a little daunting to see how much work there is going forward. And in the pressures that we have with increased problems with reimbursement, declining enrollment of patients moving out of the area, it seems like there's an overwhelming amount of pressures on us, and I'm hoping that electronic health records can be the least stumbling block for us. Something that can really help us be able to connect and be with our patients, to be able to care for them, and in a way really make it an efficient connection that they can understand. They are going to be able to review the work that we've done with them at home with their personal health records. At PAMF, we have 1 million patients here on the peninsula, and a third of them are using the online personal health record work and accessing that from their iOS devices. Looking forward to trying to get them onto Android as well, which makes it so much easier than trying to browse a little web browser-based PHR. I don't know if many of your patients have tried to connect and try and figure out in the grocery line where to click, and damn it, I clicked on the wrong place on the screen. Instead, I'm hoping that there will be connections, apps that make it easier for them to document their health and connect to you and have you get the information that's really the most important for you to be able to care for that patient. Not loads and loads, volumes of stuff that are really useless to us, but really things that could be really revolutionary. There's interesting devices out there that are connecting patients' weights off their Bluetooth to their iOS devices, and we can actually review those, and if they're increasing in their weight, we can call them and let them know that they need to take a little more Lasix for their CHF. I mean, there's a lot of these things that can be worked into our disease management programs and ways that we can really improve care for our patients in an automated way, have our nurses do a lot of that as well. And I'm hoping that these kind of tools and products will be more and more available in an affordable way for us. So I'm so glad that I had a chance to speak with you. I'm hoping that some of you will approach me later and be willing to chat with me, because much of the international work that I've done in Haiti and now Japan, our 4th trip is currently in Japan right now, helping out in Shinamaki in the disaster area where the tsunami washed everything out. And you would not believe the kind of pressures that you face in a disaster lead you to use the specific functions in an electronic health record. For example, in Haiti, we found there's just such a large number of patients seeking our care that we would really focus on just putting in the diagnosis. At least if we had that, we could see what we were treating and then bring the right kind of meds the next time and see from trip to trip. We had 9 trips over many hundreds of physicians and nurses go. We were so glad that we were able to use Hippocrates tools, and Tom's here, Tom Giannulli's here to share some of the new tools that they have. I'm so glad that there are really not only revolutionary but really philanthropically minded companies here today. And I'm so glad that you're willing to hear me blab and blab about it. So I'd like